Please note that the individuals shown in this video are for illustrative purposes only and may not be actual healthcare professionals or patients. Thank you. Religious Obsessive-Compulsive Disorder, OCD, also known as scrupulosity, represents a manifestation of OCD where an individual experiences excessive concerns related to religion, morality, and ethics. These obsessions can cause significant distress, as the person struggles with persistent intrusive thoughts and fears about sinning, moral failure, or religious inadequacy. Unlike traditional OCD, which might focus on fears of contamination or a need for order, scrupulosity centers on spiritual and ethical concerns, making it particularly challenging for those with deep religious convictions. Individuals with religious OCD may worry excessively about offending God, going to hell, or not practicing their faith correctly. They might fear having blasphemous thoughts or believe they must perform religious rituals perfectly to avoid divine punishment. These fears lead to compulsive behaviors aimed at reducing their anxiety or preventing their feared outcomes. Compulsions can include excessive praying, repeating religious phrases, confessing perceived sins repeatedly, or engaging in rituals beyond what is required by their faith. The internal struggle is often intensified by the individual's recognition that their fears may be irrational or excessive, yet feeling powerless to control them. This can result in a vicious cycle of obsession and compulsion, significantly impacting the person's daily functioning and spiritual life. It's not uncommon for individuals with scrupulosity to avoid religious practices altogether in an attempt to escape their obsessions, paradoxically leading to further distress about their spiritual well-being. Treatment for religious OCD typically involves cognitive behavioral therapy, CBT, particularly exposure and response prevention, ERP. ERP challenges individuals to face their fears without resorting to compulsions, gradually reducing the anxiety associated with their obsessions. In some cases, therapy may be adapted to incorporate the individual's faith, working with religious leaders who understand OCD to ensure that treatment respects the person's beliefs. Medications, such as SSRIs, may also be effective in managing symptoms. Religious OCD is a complex condition that requires sensitive, nuanced treatment approaches. Understanding and addressing the unique aspects of scrupulosity can help those affected find relief from their symptoms and reclaim a healthy, balanced relationship with their faith.